Wells Fargo Bank failed to shake off Fair Housing Act and federal civil rights claims brought by a black couple who alleged the company lowballed their refinancing appraisal due to their race.
Oh, Wells Fargo. Okay, so a U.S. District Court judge ruled that Bridget and Joseph Washington can proceed with their claims of racial discrimination under North Carolina's consumer protection law. Now, according to the complaint, Wells Fargo initially estimated the value of their home at $525,000, but also required an in-person appraisal. The appraisal company valued the home at $480,000, which is $10,000 less than the 2018 appraisal. Now, despite the fact that values in the area had increased in the past several years. According to the complaint, shortly afterwards, that couple applied to refinance with another company without disclosing their race, resulting in an appraisal of $540,000.
Emergency benefits that have helped boost payments to SNAP recipients during the COVID-19 pandemic are set to end soon, leaving families with less money and high grocery prices. According to the U.S. Department of Agriculture's Food Nutrition Service, in 17 states, those added emergency benefits have already expired as of January. In the remaining 32 states, plus Washington, D.C., Guam, and the U.S. Virgin Islands, the extra money will dry up starting with the March 2023 benefit month. Nationally, the minimum benefit is $20 a month.
And more stats for you here, Soulmates, as according to the recent U.S. Census Bureau data, there are currently 38 million people living in poverty and 21 million are women. Black women represent over 22% of women in poverty, but only account for 12% of all women in the U.S. population. While there are many contributing factors such as rising costs, financial burdens from medical and or child care expenses, and debt that led to such cases, there are also underlying discriminatory practices that uniquely impact the economic state of Black women. Now, for Black families, home ownership is power, but too often out of reach for Black women, who are 256% more likely to receive a subprime mortgage than their white counterparts with the same credit score and economic position.
A massive coordinated scheme to sell false and fraudulent nursing degrees credentials have been brought down by a joint federal law enforcement operation. The sweeping enforcement action spanned 5 states, including Florida, New York, New Jersey, Texas, and Delaware, and resulted in more than 24 criminal wire fraud and wire fraud conspiracy charges against 25 individuals. Officials said nursing candidates who allegedly participated paid as much as $15,000 for the fraudulent diplomas. Officials said the conspiracy involved the distribution of over 7,600 fake nursing diplomas and certificates issued by a Florida-based nursing program. And, you know, if you have a loved one in a nursing facility, hearing this story may be very hard to hear. To think that there just might be a nursing home staff that has not been properly trained and has been operating off of a fraudulent credential certainly doesn't give me comfort.
And you know, and are clearly not qualified or would fall short in whatever, you know, specialty they're claiming to be, you know, trained in. This is actually horrific, because now you're talking about people's lives and people's well-being, and you're talking about the trust of a patient and a patient's family. And I just don't understand how people think that, you know, it's okay, one, to do this and then participate in not thinking that eventually something wouldn't blow and you wouldn't be caught and or caught up. And so it's just very unfortunate. And I'm glad, you know, they've been able to get a handle on this and, you know, tap into these nurses who are in fact not nurses and don't need to be, you know, claiming to be such, and cleaning that system out, if you will.
And Courtney, you know, when I first read this story, I thought a lot about the darkest days of the pandemic. And remember when there were loved ones that were in nursing homes that could not visit with their relatives, they couldn't see their loved one up close. At some point, people were able to look at them through a glass window, maybe. But think about how many folks were in these nursing homes with folks that were operating with these fraudulent credentials. And it makes me wonder, with all the lives that were lost during the darkest days of the pandemic, was there a connection between folks that were ill-equipped to care for them and this scandal that the DOJ has brought
uncovered.
to light?
On the other side of it, there are some amazing nurses. I know during my health crisis, I wouldn't be here without the nurses. Appreciate the doctors, but it was the day-to-day that the nurses were able to tap in and really help bring me on out of that situation. So we love our nurses. This is just an unfortunate situation. We're going to move on here. As gay and bisexual men in monogamous relationships would no longer be forced to abstain from sex to donate blood under federal guidelines. It's ending an era of the earliest days of the AIDS crisis. The proposed relaxation of these restrictions by the FDA follows years of pressure by blood banks, the American Medical Association, and LGBTQ rights organizations to abandon rules some experts say are outdated, homophobic, and ineffective at keeping the nation's blood supply safe. Sources also say there is no exception for people taking daily pills that drastically reduce the risk of contracting HIV. There's no exception for those who consistently wear condoms and for those who can present a negative HIV test.
A coalition of disability and civil rights advocates is suing the California Supreme Court to block the rollout of Governor Gavin Newsom's far-reaching new plan to address severe mental illness by compelling treatment for thousands of people. The groups argue that the sweeping new court system will violate due process and equal protection under the state constitution, while, quotes, needlessly burdening fundamental rights to privacy, autonomy, and liberty. Governor Newsom's spokesperson said efforts to delay or block the law's implementation would needlessly extend the suffering of those who desperately need our help. Newsom announced Care Court last spring as a new strategy to help an estimated 7,000 to 12,000 Californians struggling with severe mental health disorders like schizophrenia, access to housing, treatment, and mental health services.
And a team of researchers found that Black and Hispanic veterans waited longer for some medical services at Veteran Affairs hospitals during the COVID-19 pandemic than their white counterparts. Now, those researchers who worked with the VA included in the study their analysis over 1 million veterans who access services at VA facilities and focused on wait times for orthopedic and cardiology services. They found wait times for all racial groups increased during the pandemic years, but that the wait times were even longer for Black and Hispanic veterans. Now, according to that analysis, on average, Black and Hispanic veterans waited 2.5 days longer to access orthopedic services compared to their white counterparts.
Black Americans are 40% more likely to have asthma than white Americans. Black children are 5 times more likely to be hospitalized for the chronic lung condition. And while asthma-related deaths are decreasing overall, they remain most common among Black Americans. These disparities make the contentious debate over banning gas stoves a particularly important one in Black communities. The kitchen appliance is known to emit dangerous pollutants like carbon monoxide, nitrogen dioxide, and formaldehyde, though research varies on how much those emissions affect asthma rates. California committed to phasing out natural gas furnaces and heaters by 2030. The District of Columbia and New York State are considering similar bans.
I don't know. Listen, lots of us grew up, cooking on or being nearby gas stoves. I happen to prefer the way gas cooks over electric heat. I do understand, what these new reports and analysis are saying. I happen to think that as far as the asthma rates among Black folks, historically it had to do with, we were factory. We were blue collar workers and we lived close by, these factories in these cities, especially when, we migrated from the south up to the north. And I think environmentally that may have a lot more to do with the fact that we have such issues with respiratory issues and asthma and things like that, more so than the gas. Of course, you want to take note and hear what the experts are saying, but generation on top of generation on top of generation has been, if you will, born and raised when it comes to using gas in their homes. So I hear them, but I think that's going to be a bit of a tough task to get people to flip.
I think so.
Gas is cheaper too.
It is, and I think so many good cooks prefer a gas oven, but I think you're going to see this call for a federal ban to continue. The president has come out and has not suggested that he supports a federal ban, but I know there are Democrats in Congress, like Senator Cory Booker, that appears to support a ban. I think a lot of people are saying, let's just limit how many gas stoves that are out there. Let's start there. Let's start with, federal public housing facilities where there is some research that suggests that it may impact the health of Black kids. And so I think there's still so much more to study, but, my husband has asthma and, it's nothing fun. And so if there's anything we can do to minimize it, why not?
I'd agree. That's going to be a hard sell, though. All right, there's so much more to come on Fox Soul's Black Report.
Including one school that's canceling all of its Black History Month events. We'll tell you why when we return. You're watching Fox Soul's Black Report.